Simulation is a technique for interactive and often immersive activities that recreate experiences of a real world. Healthcare simulation can be said to have four main purposes: education, assessment, research, and health system integration in facilitating patient safety. Each of these purposes may be met by some combination of role-play, low and high-tech tools, and a variety of settings, from tabletop sessions to a realistic full clinical setting. Healthcare simulation is a range of activities that shares a broad similar purpose: to improve the safety, effectiveness, and efficiency of healthcare services.
We say that simulation is a technique, not a technology, because for many purposes, we can do the technique of simulation, meaning recreating elements of the real world for our particular purposes, with the use of very little technology or even none at all. Think, for example, of verbal simulation or storytelling. Clinicians have always told stories of their tough cases, and when you hear such a story, you're probably simulating in your head, what would I do in that situation?
Our journey into healthcare simulation has brought us today to Stanford, California, where we are privileged to be at the Stanford School of Medicine's Center for Immersive and Simulation-Based Learning to speak with two leaders from the Society for Simulation in Healthcare. Since its inception in 2004, SSH, now with more than 4,000 members in the world, has banked on its ability to meet growing and changing educational needs of professionals to become the largest healthcare simulation society or association in the world.
Our organization has over 4,000 members representing over 50 countries worldwide. Our members include physicians, nurses, simulation operations specialists and technicians, directors, administrators, veterinarians, dentists, and more. The purpose of the Society is to foster a community of practice in the global environment, thus enhancing quality in patient care. Our goal is to use simulation to help learners experience what they would experience in a real-life event in a very safe environment, not causing any harm to the patient.
While some kinds of simulation probably date back even to prehistoric times, such as storytelling, healthcare has only really begun to embrace simulation in the last 35 years. And although its use has become commonplace for trainees in clinical professions, there is still a long way to go to fully embed simulation in the fabric of how we do healthcare.
In the early 2000s, there was growing interest in simulation in healthcare, and there was a small annual professional conference in the US on the topic. But there was no formal organization to run those meetings. So the Society for Simulation in Healthcare was formed as a full professional society. One of the visionary goals for SSH and for the entire simulation community is to see that simulation activities of many different kinds become completely routine for everyone involved in patient care for their entire careers. We want simulation to be completely embedded into how we do healthcare. And that's the way it's done in other areas such as commercial aviation, nuclear power, or key parts of the military.
The Society has a very strong strategic plan. And we have shared our strategic plan with our partners around the world, our affiliates, so that together we can work to ensure that we have standards in place and that we're spreading the word globally about simulation.
Companies in the healthcare simulation space are recognizing the immense value and credit that the SSH name provides members, non-members, and the industry at large through its leadership, programs, and initiatives. Companies also experience that value through strategic partnerships and SSH's Growing Affiliates program, which exists as a way for SSH to work with other organizations who are committed to advancing the field of healthcare simulation.
We've learned over the years that we need standards in place, and our organization actually has an accreditation and certification mechanism. We have accredited simulation centers all over the world, and we have over 2,000 certified healthcare simulation educators and certified simulation operations specialists worldwide. These are the things that we have put into place to ensure the quality of our faculty out there doing simulation. We want the learner to have a positive experience in simulation.
SSH is in a unique position as a leader with its live and online offerings for members, not to mention its extensive resources available through the ssih.org website. The impact SSH is having on the space is immense and growing. The number of SSH credentialed professionals is now in the thousands and continues to climb. And those who do earn credentials are exhibiting long-term engagement with SSH in different ways, ranging from repeat event attendance, engagement as speakers or session leaders, and serving as word-of-mouth SSH ambassadors to others in their workspaces.
SSH provides education about simulation, accreditation of simulation centers, and certification of simulation professionals. It would be impossible to overstate the critical role that SSH has had in driving the field forward in the past, for the present, and into the future.
The Society is here for you to make sure that you are safe and that your healthcare providers are trained accordingly and that will provide the best care possible to you when you become a patient.
Through dedicated efforts of professionals around the world, simulation in healthcare has spread to nearly every country, to every part of healthcare, to all healthcare professions, and for all experience levels of participants. It is not limited just to high-resource areas, but is applicable in various ways to both rich and poor locations. SSH will continue to push forward in its mission and champion healthcare simulation through advocating, sharing, facilitating, and collaborating.